Hello and welcome to my presentation, Little Teeth, Big Problems. This is a presentation on how to keep your child's teeth cavity-free. So to start, I'm going to tell you all a little bit about myself. I am a BS student and an RDH. I graduated with an associate's degree in dental hygiene from Georgia Highlands College in 2014. I've been working full-time at a general dental office in Buckhead, Atlanta now for about a year, but recently I accepted a new position as a full-time dental hygienist in a general practice at St. Joseph's Hospital. I'm really enjoying it there. After almost a year of practicing dental hygiene, I decided to go back to school to get my bachelor's degree. Currently, I'm attending Georgia Highlands College again, and I estimate that I will graduate summer of 2016 with my Bachelor of Science in Dental Hygiene. Afterwards, I plan to go on to obtain my degree as a PA, so hopefully I will be a dental hygienist and a physician's assistant at some point. So now we are going to move on to a pretest. Today I will be discussing the link between a cariogenic diet in relation to early childhood caries and also how poor home care is related to that as well. So I'm going to start by handing out a quiz to test your knowledge about my topic. Don't worry about getting everything right. That's why we're here at this presentation, so that I can teach you. Please put your initials at the top of the quiz. This is just for comparison only. Please answer the questions and then hand the quiz back to me. I will be giving you 5 minutes. During this time, I will pass out my quiz and allow the audience to have 5 minutes to complete it, and then they will turn it in. I have added a time clock that will count down so that the audience will be aware of how much time is left during the pretest. So we're going to start with questions for you. I want to start by asking you all a couple of questions that relate to my topic. This will kind of be a great icebreaker and get everybody on the same page. Raise your hand if you have a child that has or has had a cavity. At this point, my audience would raise their hand. I would select one and say, how do you think this cavity has occurred? I will give my audience about 5 minutes for question and answers. Who of you had a cavity as a child? Do you think it was preventable? So raise your hand if you've had a cavity. And now think about whether that was preventable or not. Did your experience affect the way that you care for your own child's teeth? And now I would select somebody from the audience and they would give me an answer. Goals and objectives for today. The goal for today is to improve the education and awareness that you all have on the link between poor home care and a cariogenic diet to early childhood caries. Caries, better known as cavities, so I may use that word interchangeably, and we'll elaborate on that in just a moment. By the end of this lecture, you will be able to, 1, define early childhood caries, 2, visually identify the different stages of early childhood caries, 3, define what makes up a cariogenic diet and what exactly is a cariogenic diet, 4, list the risk factors for early childhood caries, and 5, describe the link between cariogenic diet and poor home care and how it relates to early childhood caries. Tooth decay is the single most common chronic childhood disease. It is 5 times more common than asthma, 4 times more common than early childhood obesity, and 20 times more common than diabetes. Early childhood caries is a multifactorial disease process initiated by bacteria. This bacteria is primarily Streptococcus mutans, and this is directly from the American Academy of Pediatric Dentistry. So what are early childhood caries? Childhood caries is an infectious disease. It is the single most common childhood disease, even more common than the common cold. According to the American Dental Association, Childhood caries are defined as one or more baby teeth that are decayed, which would mean have a cavity, filled, meaning they've had a cavity and place to fill it, or that they're missing. This would not be due to natural tooth loss, not where the adult tooth is coming in and pushing the baby tooth out, but where the tooth was so decayed it had to be removed. And this covers children ages ranging from birth to 71 months of age. How do caries affect your child? Caries can affect one baby tooth, as we said, or all of the baby teeth. So cavities can be localized to one area, or it can be rampant throughout the entire mouth. They can cause pain and infections, and many of you have probably experienced this if you've had a cavity that it's gotten bad enough. Once the cavity penetrates the nerve, which would be in the very center of the tooth, this means that the cavity has went through the enamel, it's just the outer layer, the dent in the second layer, and it's gotten to the nerve. The bacteria can produce painful infections in the tooth. There is also the risk that this infection will spread throughout the bloodstream. So anytime we get an infection, it's a big deal. So the mouth is no different. They can cause premature tooth loss, leading to unnecessary crowding. The way this happens, it's because the baby tooth holds space for the adult teeth to come in. If they lose that baby tooth too soon, or the adult tooth is ready to come in, the teeth will actually start to come in wherever they find it fit. So it will come in crooked because there was no baby tooth there to create space and kind of guide that tooth into position. This can also affect speech development. So in order to articulate certain words during talking, we tap the backs of our teeth with our tongue. If we lose certain teeth too early, children are going to have issues learning how to pronounce certain words because they are going through these developmental ages. So they're learning to enunciate and pronounce things. So if they don't have the correct teeth in at the correct times, it can cause a delay in their speech. Cavities can also affect eating, playing, sleeping, growth, and development. If a child is in pain or doesn't have very many teeth, this is going to affect what the child can eat and how often they feel like eating. So they may avoid harder foods such as raw vegetables, which are actually very good for them and very important at this stage in their life. A child who is in pain will not play or sleep well. We probably all had a sick child in this room at some point, so we know how not feeling well affects how they stay up all night or they don't feel like playing. Overall, they generally don't feel well. So a lack of eating and sleeping can interfere with the child's growth and development. So not only is this a physical issue, but it can also become a mental issue. The child might not mentally develop as fast enough because this also applies to a child will miss school if they have pain or if they have to go to an emergency visit at a dental office, or maybe they're having trouble paying attention in school because they're in pain. So it can affect them this way as well. Why is it important to educate about your early childhood caries? According to the American Academy of Pediatric Dentistry, early childhood caries is the most common chronic childhood disease, as we've stated. Nearly half of U.S. 5-year-olds have experienced tooth decay. This statistic is staggering. The reason is this disease is completely preventable. It's just that the awareness and education has not been applied to everyone. It is important to raise awareness and education to the public so that we do not continue to put our children's health and well-being at risk. We all want what's best for our children. Dental health professionals such as myself want to create awareness, educate the public, and reduce the amount of children that is affected. This is a little chart I've created to kind of simplify how a cavity starts. So first, there is bacteria present in the mouth. This bacteria feeds off sugars and starches. We get sugars and starches through the meals that we eat throughout the day. Then sugars and starches provide food for the bacteria. This creates acid. Acid will attack the enamel of the teeth, which makes it weak. When the tooth becomes weak, it is susceptible to becoming decayed. Bacteria gets in and it forms a cavity. So now that we know what exactly a cavity is, let's move on to identifying the different stages of early childhood caries. You can do this by lifting the lip. Lift the lip. The upper front teeth are usually the first baby teeth affected by caries. So you can go in, and if you're curious about your child's teeth, I advise you to lift up their upper lip and check out those front four teeth and see if you see any of the following signs. Stage 1 is called incipient decay, or better known as very early decay. It appears as chalky white spots on the teeth. This is normally near the gum line. This stage is where you start to lose minerals from the outer layer of your teeth called the enamel. Now, the enamel is the strongest substance in your entire body. It is even harder than your bones. At this stage, the cavity can be arrested or stopped and reversed before it becomes an actual cavity. So this is your act now stage. Good home care and fluoride treatments can help stop further decay and help to reharden the outer layer of the tooth, the enamel. So it's going to replace those minerals back when you're using fluoride, and of course good home care is just going to keep that area free from more acidic plaque that would further the cavity. Let's take a look at stage 2. The second stage is actual decay. So this stage is no longer reversible. You have to have something done at this stage to prevent the cavity from getting worse. Moderate decay will appear as brown spots on the teeth. The first and second layers, so the enamel and the second layer is dentin. They have now been broken down. So permanent damage has occurred to the teeth. At this stage, the tooth must be filled in order to preserve it. So the dentist will remove all of the decay and all of the bacteria, and he will put a filling in the tooth to preserve it. Sometimes, if it's going to be a very large filling and too much of the tooth surface has been lost, they will put a crown, or some of you may know this as a cap, on the teeth. Stage 3. Stage 3 is severe decay. At this stage, most of the tooth structure has been lost, and severe pain and infection usually occur. The nerve of the tooth is involved, and as we've mentioned earlier, it's at the very center. We're now through the enamel, dentin, and into the nerve. This stage usually results in loss of the tooth, unfortunately. The more teeth that are involved, the more likely that your child may need to be put to sleep in order to perform the dental work. This can be very traumatic for your child, and it can also be dangerous. I say this because the child usually ends up associating the dentist with pain and being a fearful experience because they're having to be put under, they're having a lot of work done. It's just not fun. We as adults don't enjoy this either. We want to make sure they associate the dentist as a fun visit for preventative work. If there are always risks when you put a child this small under anesthesia, so it's best if this type of situation can be avoided. Normally, they will put off anesthesia for severe cases where a lot of work needs to be done if it's very extensive. But this does allow it to be completed quickly while being less stressful for the child. Let's start talking about some causes of early childhood caries. What is a cariogenic diet? We've mentioned it several times now, but what exactly is it? A cariogenic diet is a diet made up of food and drinks that promote the development of tooth decay or that cause tooth decay. If I asked you all to think about foods and drinks that cause cavities, you would probably all list sugary sweets and soda, and you would be correct. So candy, cupcakes, Mountain Dew, Coca-Cola, all of these are cariogenic foods. These foods should be given to the child very sparingly, including soda, if at all. I absolutely agree with not giving your child soda, but if you do, that's fine. Let's just make it a special treat. What you might not suspect, though, are other foods and drinks that are actually very healthy, but they can also cause tooth decay. Let's talk about those. Bread, cereals and crackers. These are very common snacks given to toddlers and children. So bread, cereals, and crackers, especially sweetened ones, are something called fermentable carbohydrates. They are broken down in the mouth. To put it simply, your saliva helps to break these foods down in the mouth so that you can easily digest them, but in turn, a lot of acid is produced. We now know that acid weakens the tooth and helps to cause cavities. Dried fruits. These are full of sugar. Even though it is natural, it is still bad for the teeth. Sticky foods, such as dried fruits and fruit snacks, can also cause cavities because they adhere to the teeth for a long period of time. So your saliva normally tries to help wash off foods off the teeth. But because these are so sticky, it's a lot harder. So they remain on the tooth surface, producing more acid for longer periods of time. Even fresh fruits can be a risk. Fruits such as tomatoes, grapefruits, oranges, and many others are also very acidic, and if eaten frequently throughout the day can weaken the teeth, making them more susceptible to decay. We've all seen children do this. They'll suck on lemons at restaurants, and maybe we even did it ourselves. It's mostly about the frequency, but these foods still should be avoided when they're acidic as lemon. Fruit juice and milk. Milk and juice are often given to a child to sip on throughout the day, often in a bottle or a sippy cup. It's a much healthier option than soda or sweet tea. The problem here is that not the milk and juice itself, but the frequency that the child is exposed to it. If we drink milk and juice with meals, it doesn't stay in our mouths very long. However, if a child is constantly sipping on these throughout the day, they are exposing themselves to multiple acid attacks. And I want to reiterate frequency for all of these foods. All of these foods are actually very healthy. Your child is going to need grains, they're going to need fruit, milk, but we just want to make sure that we do this at meals. So it's not necessarily the food. I'm not saying that any of these foods are bad foods. We just want to make sure that the frequency is kept to a minimum. You can eat 3 cupcakes, but it's better to eat those 3 cupcakes in one sitting than it is to eat them within a few hours. So you get one acid attack versus multiple acid attacks. Your mouth is able to buffer off that acid and return to a neutral state. So if any of you are familiar with the neutral pH of your mouth, we want it to be in between alkaline and acidic, and so this is just allowing it to stay at the neutral position where it needs to be. All right, never put your child to bed with a bottle or sippy cup containing anything other than water. I know that a lot of toddlers request something to go to bed with. Babies request bottles to go to bed with. It's comforting, but you have to be careful. Children will develop baby bottle tooth decay. So baby bottle tooth decay, or bottle rot, is another common term for this. It's where a child develops cavities from being put to bed with a bottle or sippy cup full of any beverage other than water. If you are putting your child to bed with a bottle or sippy cup with anything but water, not only are you not removing all of that acidic plaque from your child's teeth before bed, but they don't have as much saliva flow at night. Remember, the saliva is helping to buffer off those acids and foods. So they're not talking as much, they're not eating or drinking, so nothing stimulating that saliva, their mouth dries up, and the risk for cavities increases. So we have discussed that a ketogenic diet is a major risk factor for early childhood caries, but there are other risk factors that are also very important. So we're going to talk a little bit about those now. Not receiving enough fluoride. Fluoride greatly reduces the risk of decay, and as we've mentioned, it also helps to stop and repair early signs of cavities, those incipient lesions we mentioned. When given appropriately, fluoride is completely safe and is actually recommended by dentists. And this does depend on your child's age, so you will want to discuss this with your dentist at the appropriate measurement to give your child or what needs to be introduced to your child as far as fluoride goes. If you have well water or you drink only bottled water, or even if you have certain filtration systems installed in your sink, you may actually be preventing your child from receiving fluoridated water. City water is normally fluoridated, whereas well water is not. A lot of bottled waters do not include fluoride, and certain filtration systems actually filter out the fluoride that's been added to your city water. If your child uses all natural toothpaste, they may not contain fluoride. I know that you as parents are very concerned about what your children are putting into their bodies, and I have noticed that a lot of parents are switching over to these types of natural toothpaste, such as Tom's. While I understand your reasoning behind this, and I applaud you for introducing healthy options for your children in all types of products and foods, you may be increasing your child's risk for cavities because they're missing out on that fluoride. Also, having a mentally or physically disabled child can increase your risk for cavities. Providing thorough home care to any child can be a challenge. Sometimes special needs and handicaps make this process especially difficult. Providing adequate home care for a child can be challenging if the child is combative or if they're disinterested, or maybe they're just very wiggly and it's hard to get them to sit still. My heart goes out to all of you parents that work so hard to provide your special needs children with great home care. I recommend just remaining patient, trying your best. Stick to a regimen. Always stick to that routine. Even if it doesn't go well, you still did it, you still attempted it, and that's becoming instilled in your child's daily routine. That's a good thing. The child may become unmotivated about oral health if it's very difficult for them. This is completely understandable, and many adults experience this. So just try to keep your child positive about this. Always applaud them for trying. And if you need some extra ideas or help with this, always talk to your hygienist or your dentist. We're here to help you. If your child has xerostomia is a big fancy word that just means dry mouth. Without adequate saliva helping to wash away that acidic plaque and food, your child is at greater risk for decay. So many medications can actually cause dry mouth. Ask your doctor if your child is on medication if that is one of the symptoms or side effects. Certain medical conditions can also cause dry mouths. If your child is a mouth breather for sinus reasons, or maybe they just, when they're asleep, they breathe through their mouth, this will also increase how dry their mouth is. If your child has this condition, you can try over-the-counter saliva substitutes. Depending on the age, some might be better than others. They have a rinse. If your child is good about not swallowing the rinse, it's a great option. They also have gels and toothpaste. However, if the problem still persists, talk to your pediatrician about prescription strength saliva substitutes or maybe even prescription medication to help combat their xerostomia. Sometimes this is an option and sometimes it's not. It just depends on the medication your child is already on. If you or the child's siblings have or have had decay, it does increase your risk for childhood caries. So if your siblings have had cavities, it increases this risk because the bacteria that causes it, Streptococcus mutans, can be transferred from parent to child or in between siblings. So my recommendations to you are, 1, do not clean off pacifiers with your mouth. Now, not only does this not clean the pacifier, you are actually just introducing yourselves to the bacteria that was on the floor, and your child is still getting this bacteria, but you may be adding to that bacteria. This is because if you have any decay in the mouth, you have Streptococcus mutans, or if you have certain kinds of gum disease, you can also be transferring the bacteria from that to your child. Definitely want to avoid doing that. The same rule also applies to sharing eating utensils or cups with your child, and we've all been guilty of that. I've done that myself. It's just a good rule of thumb to keep everyone's things separate and just give the child their own cup and utensil. As far as the pacifier goes, I recommend keeping backup pacifiers and also antibacterial wipes in your baby bag. That way you can safely sanitize the pacifier back to your child. If there is not any preventative dental care, so not all dental care takes place after you get a cavity or after there's a problem. Our goal as dental professionals is to prevent that problem from happening to begin with. We want this to be a good, pleasant experience. We want you to maintain good health. So regular visits to the dentist for preventative care will reduce the likelihood that your child will ever even develop decay. And in the event that your child does get a cavity, because things do happen, no one is perfect, it will reduce the likelihood of them losing that tooth. We'll catch it early. Dentists will assess the health of your child's teeth. They fill cavities before they compromise the whole tooth, and they inform and educate you on your child's dental needs. Hygienists will provide your children with thorough cleanings. We take diagnostic x-rays, so we take these x-rays to see if anything's wrong before it gets really bad, and we educate you and your child on how to partake in good oral health care. Everyone is different. A full assessment will allow us to develop a custom home care regimen for you. Regular dental visits also help the child to associate going to the dentist as a good thing. It can be a fun experience, not something that they should relate to fear or that should stress them out. This way they become comfortable with allowing us to do different procedures, and they become comfortable with you helping them at home as well. Not assisting your child with their oral home care. So children are very, very smart. They surprise us sometimes with how smart they are. So we almost always assume they can do everything on their own, and this can include brushing and flossing. But the truth is, children are too young for their minds to fully comprehend how to properly brush and floss. They think they're brushing very well, and they think they're flossing very well, but of course we know they don't really know to mentally say, I need to angle it this way, I need to turn my toothbrush this way. They kind of just get in there and scrub everything for about 10 seconds. So it's up to us to kind of help teach them. Children do not have the dexterity to be able to properly brush and floss. This means that their bodies have not developed enough physically for them to know how to move the toothbrush and floss. It's not just a mental thing, it's a physical thing as well. Children do not have, or it is the parent's responsibility to brush and floss for the child. So we've already stated they can't do this on their own. You are their caregiver, therefore it becomes your responsibility. It is strongly encouraged that you allow them to do it themselves first, okay? Then go back behind them to check and make sure that all the plaque and debris has been removed from the teeth. You can make this into a game so that your child does not feel as though they've done a bad job. So what we're doing here is we're allowing them to build up the mental capacity to do this. We're allowing them to practice their dexterity, and we're still going back behind and making sure they do a good job. So a recommendation I make to my patients in practice is to call plaque sugar bugs, and I always tell my children 4 eyes are better than 2. So I let them go first, and I'm going to say, okay, I'm going to go back through and make sure that there are no more sugar bugs hiding. They're very tricky. Sounds very silly, but it works. They'll be very eager to let you get in there. They don't want sugar bugs on their teeth. So I found this to be a good method, so you can try that at home. When your child is old enough to brush and floss by themselves, and everyone is different, so one of your children may be ready before the other, or you might have friends that their children are already doing a really good job on their own, and maybe your child isn't quite there yet, and that's fine. Everybody learns at a different pace. You need to be holding them accountable when they reach this stage, because a child will say, yes, I brushed my teeth, but we all know that means a quick swish swish. So I would visually monitor this, and even up into the teenage years, unfortunately, we might have to go through and make sure that our teenagers are doing a good job as well. For flossing, I will be going over and showing you how to properly brush and floss your child's teeth later on in this presentation. But I do encourage you, instead of trying to do the old-fashioned way, the string around the fingers, it might be easier for you to take the pre-woven floss picks and floss your child's teeth. It's just easier for you, and it's a neat way for them to start practicing as well. It's a lot easier. So we now know what causes the majority of childhood caries. This would be the carriogenic diet that we've been discussing and poor home care. But what is the missing link? What connects all three of these things? So that's what we're going to talk about now. Parenting guardian. That's right. You are the missing link. Your education and awareness of early childhood caries is the missing link to this. So we now know what causes the majority of childhood caries. A parent's awareness about early childhood caries and how they implement the knowledge that they've learned is going to affect whether or not your child develops cavities or to what extent. A child does not buy their own meals, they don't choose their own meals, so you're in charge of that, so you can greatly improve their diets, make sure they're not carcinogenic. A child cannot fully comprehend or carry out good oral hygiene at home, but fortunately you can, so you're there to help them. And now that we have the knowledge, let's choose to use it to help in early childhood caries. Prevention is always the best strategy. As soon as the first tooth erupts, the risk for decay is present. And even though it seems really early, this is why we recommend you visit your dentist after the eruption of your child's first tooth. For your infants that do not have teeth, swab out their mouths with a wet cloth after bottle feeding or breastfeeding. So even though they do not have teeth to decay, it's still going to produce a milky film in their mouth, which I know I personally wouldn't want. So you can do that, like I said, with a wet cloth, or you can actually purchase individually wrapped swabs for the mouth, little cloths. They make them flavored. Of course, they're sugar-free, but they're easy and all natural to use. A lot of them use bamboo, so it's a neat product. Remember to introduce flossing to toddlers and to do it for them once a day. Use appropriate fluoridated toothpaste for your child's age. Again, consult your dentist for this. When they are old enough to have it, of course, again, ask your dentist about their age as well. Limit frequent snacking and only serve milk and juice with meals. Limit soda and candy to special occasions if you give it to them at all. And do not put a child to bed with anything other than water. Make sure you follow your dentist's directions on attending regular preventative care visits. Normally this is twice a year, but again, everyone is different, so you might have a different plan. Do not share cups or eating utensils with your child or in siblings, and do not put your child's pacifier in your own mouth and attempt to clean it. Education. If you have any friends or family with children, please share with them the information that you have learned today. If you have not already taken your child to the dentist and they have erupted teeth, please do so. Talk to your dentist about your child's needs. Ask your hygienist about the most effective way to brush and floss your child's teeth. And further educate yourself by visiting websites, checking out YouTube videos, and talking to dental professionals. I'm going to sum up things that we've learned today. Remember that it's ultimately up to you to ensure that your child does not suffer from early childhood caries. Oral home care and a carcinogenic diet have been proven to cause early childhood caries. Therefore, if you or your children, or if you have children or are thinking of having children, educate yourself on how to play a role in your child's oral health care. After the first erupted tooth, schedule your child's dental appointment to ensure that you are educated and doing everything possible to prevent your child from developing early childhood caries. Education is key. So now let's move on to our quick tutorial on how to brush and floss your child's teeth. I'm going to give you some instructions on home care. For my real presentation, I would have a typodont to help explain how to do this. The angle. Bristles along the gum line at a 45-degree angle. Basically, you're just wanting to take that toothbrush and tilt it up. There's a picture here that shows the correct angulation. Bristles should contact both the tooth surface and the gum line. The motion. Gently, and that's your key word there, brush the outer tooth surface of 2 to 3 teeth using a vibrating back and forth rolling motion. Now, vibrating does not mean scrubbing. It literally means a small, soft vibration. A rolling motion is when the brush makes contact with the gum line and is moved downward towards the chewing surface. So you want to go top to bottom. It's almost as if you're cleaning the floor. You start at one end and you move your end to the other. Move the brush to the next group of 2 to 3 teeth and repeat until you have cleaned all of the tooth surface. Don't forget the inside. Maintain that 45-degree angle with the bristles, contacting again the tooth surface and the gum line. Gently brush using back and forth and rolling motions along all of the inner tooth surfaces. And I want to reiterate that this is something you are doing to your child. We will go over the child's methods in just a moment. So this is how you are going to brush. Reaching behind the front and the bottom teeth. We'll tilt the brush vertically. So we were holding our toothbrush horizontally to get here and here. We are now going to tilt it upside down to better reach these areas. Make several up and down strokes using the front half of the brush. So you're going to use the toe of the toothbrush to access these areas. I kind of come at it from all different angles, still keeping the toothbrush vertically. That way, if the teeth are a little crooked or turned, you're getting all of the crevices. Biting surfaces and the tongue. So the tongue is actually very important. We'll get to that in just a second. But when you are brushing the biting surfaces, this is how you're going to do it. You're going to place the brush against the biting surface of the teeth and use a gentle back and forth scrubbing motion. Okay, so there will be no rolling at this point. Parents, pay a particularly close attention to this area. There are lots of tiny grooves in the biting surfaces of the teeth. This is mostly where I find food in children's teeth, and I find a lot of cavities here most often. So make sure that you are getting those really clean. I would recommend talking to your dentist and hygienist about sealants. Sealants will kind of close up those grooves so that you can keep them cleaner and easier. That's the recommendation from me. Brush the tongue from front to back, or back to front to remove odor-producing bacteria. So when you're doing this, try not to turn the toothbrush vertically. It can gag your child. Try to keep that toothbrush horizontal. Start from back to front, and you'll just rake forward. You just want to remove this bacteria because it can cause not only bad breath, but can potentially cause infections in the mouth. So we just want to keep that area clean. So now we're going to move on to how you're going to tell your child to brush before you come and finish up the job. Okay? So this is the phone circular method for kids. It is what it sounds like. You will be making circles. So specifically, we normally start with the child biting together, as so. It involves large sweeping circular motions while the teeth are touching to clean the front of the teeth. So once you have cleaned the front of the teeth and they've made circles around everything, and that's exactly how I explain it to them, is drawing circles. We'll move to the insides of the teeth. They're going to part their jaw slightly open, and on the inside of the teeth, we'll do the same thing, same fashion. We're going to be drawing smaller circles along the insides of the teeth. You will also have to kind of help them do the different angulation on the front and bottom teeth, getting behind them as well. But just let them do the best they can. You're going to finish the job up anyway. It's more about learning and having fun at this point. Biting surfaces are brushed using a back and forth motion, just like I taught you to brush their teeth. So again, open wide and just do back and forth across those biting surfaces. Brushing should be done for 2 minutes using a soft bristled toothbrush. Do not use medium or hard toothbrushes. Even if you are very careful and very gentle, they're just too abrasive and can cause damage to the teeth and tissue. I know 2 minutes seems like an eternity, especially when you are trying to get a child to brush their teeth. I recommend using timers. Also, there are options out there such as toothbrushes that sing and play music while the child's brushing for the whole 2 minutes. So there's different ideas that you can use. Flossing techniques. So I know that I mentioned that you can use floss picks for your children, and that's really what I would recommend just for everybody's ease, but you will use part of these instructions in the floss pick. But let's go over the traditional flossing technique. You're going to need about 16 inches of floss for this. You're going to wrap them around your middle fingers. Now, normally people wrap them around their index finger, but the proper way is to wrap them around the middle fingers. You will pinch the floss between the thumbs and index finger, leaving about a 1 to 2 inch length in between fingers. You will use these thumbs to direct the floss between the upper teeth, and then you will use your index fingers to direct your floss between the lower teeth. And it kind of falls into a natural motion once you get into it, once you get used to that floss being around the middle fingers. C-shape method. This is the most important part of flossing, is that you're doing it correctly. You're going to gently guide the floss in between the teeth by using a zigzag motion. So what that means is you kind of seesaw the floss back and forth until it's through the contact of where the teeth touch. You'll feel it go through. A lot of people pop the floss in. You want to avoid doing this because it can cause trauma to the tissue, and we don't want that. So we're going to gently zigzag that floss in between the teeth until you're all the way through the contact where they are touching. Now you're going to wrap the floss around the tooth. So I've given you an illustration here. You want to make sure that you're creating a C against the tooth, and you're going to slide the floss up and down against the tooth surface and up under the gum line. Make sure you're going completely under the gum so you're not getting all of the bacteria out. Once you have done this side of the tooth, you move over to the tooth next to it, create a C around that tooth, and follow the same instructions. You'll floss each tooth thoroughly, and of course you have that much floss so that you can use a clean piece of floss for each tooth. For additional I have included a couple of websites. These will also be featured on your brochure that you get to take home today. Check them out for more information on how to brush and floss properly, and also just for any additional questions that you may have regarding your child's oral health care. Now, for your post-test, this ends my lecture. I'm going to pass out the same test that I gave you at the beginning of the lecture. Everybody should get 100% on this test because I will actually be going over the answers before you leave. You are free to keep this test as a reference back to if you have any questions. Do any of you have questions for me right now? Now I would give my audience 5 minutes to ask questions. After that 5 minutes, I will give them another 5 minutes to complete the post-test. I want to thank you all for coming to my presentation today. I hope that each and every one of you learned something new and that you feel confident in your abilities. Thank you again.